congratulate Rakesh on his wonderful success for running such a conference so successfully. So, I mean, it's very difficult, you are faced with dilemma when some patient comes to you, doctor, I think somewhere down the line I'm not able to take a decision to get married or not, because he's worried about his body image. So, definitely in the practice of sexual medicine, body image matters, and that's been probably the request for bigger the better since ages and generations. Not getting into too much into that. So of course, it's a body image disorder where the person is more worried about his genital size. It's not only genital size; it's a subform of body dysmorphia disorder where he is more worried about his penile length and girth. And what's the prevalence? You believe it or not, 40% of the patients are worried about the flaccid length, and 44% erectile length, and 15% among again the thickness. So it's a sort of somatoform disorders where people do refer and come to clinic seeking the treatment for that. Who can develop such conditions? In fact, if you ask me, there has been a sporadic of cases where when we got into this COVID situation, people, the younger generations were allowed to use the online classes, they were allowed, the parents started giving their mobiles to the children, and they realized somehow down the line, instead of doing their study work, especially beyond the first PUC, second PUC, post 10, people started trying to explore themselves and trying to correlate what are the internet, evaluations and correlating with their body image size. I've had a couple of, patients who the father came with the concern that my son was doing well in 10th standard, but suddenly off late he's become so depressed, he's become so recluse that he's not able to concentrate on his studies. For the same reason, he believes that he has a smaller penis, and it's taken a lot of effort to diagnose whether it actually has a micropenis or a dysmorphic disorder. So, I mean, he's worried about every aspect, his skin, face, stomach, and chest hairs, and yes, dysmorphic disorder, penile specifically, more worried about genital size. You have different disorders affecting your genitals, peritonitis, phimosis, paraphimosis, priapisms, Peyronie's disease, curvatures, ED. Of course, today we discuss about the penile dysmorphism. I would like to go in a certain way what is dysmorphism, how to diagnose, what's a micropenis, how to differentiate from a normal dysmorphic penis, indications for surgery, what are the types of surgery. So, what is critical for diagnosis? We need to understand that before embarking any kind of treatment modalities for us to diagnose whether he has an actual small penis or a dysmorphic penis. The fundamental, and it is very important because in infancy, when you are unable to diagnose, because that's where you have a protocol of trying to diagnose a small penis, you don't know the fundamentals how to diagnose micropenis in an infant, the probably evaluation goes in a very different and complicated way. He is diagnosed as adrenal hyperplasia, they do a lot of investigations, karyotyping, hormone analysis. Simple test of trying to evaluate the penis in a small child by a syringe technique will probably solve most of the problems. Adulthood is especially very important because that's where these takes a call on whether to get married or not. It should be very diligent, and that's where the counseling comes into picture. And yes, definitely, we believe that we don't have proper nomogram. There is such a lot of literature, hardly few literatures can do display what's an actual micropenis. Definitely, it has to be less than minus 2.5 standard deviations in a normal length for that particular age, and yes, and a diagnosed XY karyotype. We don't do this. This is a proper nomogram at different age group where you can see in the this is the micropenis length of beyond 11 years, anything less than 9.3 is considered as a micropenis. And other associations, as I told you, he has a performance anxiety, orgasmic dysfunction, sexual avoidance, and it's frequently associated with pornography use. They tend to correlate their actual penis size for what is available on the internet. Approach as more and more cosmetic surgeries are coming into the fore, we have found it very difficult to actually decide on what's the proper way to approach such cases. And limitations, definitely as Amit exactly put it, there's a positive of data, limited studies, there are no large number of studies, prospective, and also the study subjects where we're not able to conclude what is the exact treatment protocol. And of course, there's a teamwork wherein a psychiatrist is involved, accurate physical measurements to diagnose, and yes, very important, you need to document is a normal erectile function, but that's by doing the Doppler ultrasound. And what is normal? Anything, especially length or flaccid length of less than 9.16 in Caucasian males is considered as a flaccid normal length, and anything in 13.2 centimeters beard stretch penis is considered as a normal length for a Caucasian. And this is a left girth, and we have seen that there's no much difference. We try to quantify the flaccid length and the stretched penile. We have seen probably around 30% improvement in the normal flaccid length, and there's been no much difference between a stretched penile length and erected penile length. So that's where like we have a complication, we have challenges. When we decide to go for the procedures, counseling is very important. I make it a point that instead of trying, we do try to do a probably multi-angled approach and counseling. At the end of the day, we decide to go for the surgery. I make it a point that I do a video counseling. We do a video consenting where the patient is made. We have a particular protocol. We have made a consent, social consent form, so where the patient waits in front of you and it is being recorded. Because at the end of the day, doctor promises so much. Because whatever surgery you do, you are unable to go beyond maybe around maximum 2 centimeters of the achieving the penile length. But it's very important, doctor, you told me around 5 and 10 centimeters, but it's not the case. That's where consent is very important. If you go for consenting, you have a proper consent form where all the data are explained, possible complications, and also make it a point that you also mention that where your unrealistic expectations cannot be fulfilled. It's very important. Of course, we have different, when it goes to minimal invasives, we have stillers, vacuum pumps, traction devices. Invasives, we have a surgery to increase the length and girth also. And of course, in non-invasive, vacuum devices, traction therapy, and in invasive, we have lipoplasties, skin reconstruction plasties, ventral phalloplasties, total reductions, ligament release. Of these very popular is that we do reconstruction plasty and ventral phalloplasty and sustained ligament release. These are not isolated procedures. Whenever we decide to go for a practical procedures, it's always a combo of procedures we try to offer for the patient, because usually isolated may not give the desired results. And of course, to increase the girth, also we do something called as silicone injections, fat injections, and corporal length. Disassembly, elongation, phalloplasty, probably they are doing in higher centers. Research centers may not be very relevant for a dysmorphism. And this sliding tech is definitely, it's not very much practiced by me, and it's not even offered because it has its own complications. And we have grafting procedures where we do harvest the sufferance vein and probably graft it on the allogeneic to increase a flaccid girth, and we have biodegradable scaffolds and subcutaneous penile implants. What are the vacuum fraction devices? It's probably an alternate way where the patient is actually mainly for treatment of erectile dysfunctions, alternative to medical management. Most probably it's used in patients who are after radical prostatectomy. What does it do? It exploits the simple mechanism of trying to squeeze by negative pressure, squeeze the arterial inflow, which results in the oxygenation and modulation of growth factor apoptosis. And this is how you usually recommend them use it for about 20 minutes. It has particular being tubes, multiple n number of designs available online, and also a lot of people do recommend this, which has a proximal ring which fits into the root of the penis. You apply a suction, allow the patient to use it for 20 minutes every day, alternate days in a week, maybe 3 to 4 times in a week. Not much. There's no possibility of data, and there's only just psychological satisfaction. There is no objective. This one traction device. Let's take it acts by inhibiting apoptosis, stimulating cell proliferations, extracellular matrix. Where there was a study of 60 patients where they were asked to use it for like every day for 4 hours. Not even a centimeters was increment after 6 months of usage. So probably it's not very recommended. Lengthening surgery. Here it's very important for us to differentiate what's actually a buried penis and a trapped penis. Buried penis is just a decreased perceived length for many other morbid reasons like excess abdominal fat, mons pubis fat, total adiposity. Whereas in trapped penis, not only it is associated, it is also associated with other pathological or psychiatric skin condition of the penis, where because of overzealous circumcision, scar contractions, and massive swelling in terms of edema and lichen sclerosis atropicus. So we have tried to classify different ways of classification where type 1, type 2, type 3, type 4, depending upon the involvement of either it's involved only the penis, only the abdominal fat, suprapubic fat, or the whole scrotum, where their treatment model ranges from simple penile skin excision to split skin graftness to scrotal scrotectomy and translocation of the testes, and of course extensive paniculectomy. So this is the simple case where for reasons it is believed that if you try to reduce the weight, but the mons pubis fat which is probably more and more resistant to reduce. In that case, we try to do liposuction of fat, which is what we see that desired results. So, but still, it's all The patient is again, when the penis is involved, we do a skin incision and split skin grafting, where abdomen is involved, where do the mons attacking, and of course, there's extensive severe cases. And yes, skin plasty, they in fact, the skin plasty, especially VY plasty and Z plasty, they are known to increase at least 75% of the perceived penile length. It works on, kind of, you take a V-shape incisions and try to inverted V and stitch it in a probably inverted V-shape incisions and try to increase the length. Of course, wound contracture, dehiscence infection, as it is there. But as status and it can be used not only in the mental aspects, but also for patients to enhance the length on the mental aspects by doing a double V-plasty on the root of the penis for excessive scrotal skin. And Z-plasty, more commonly used for cicatrized penis or cicatrized skin after circumcision of a high penoscrotal incision, more on the mental aspects. Sensor ligament release, the main principle of using sensor ligament release, like since the penis is attached to the root of the pubic symphysis arch, we tend to do a suprapubic incisions, transverse incisions, or V-shape incisions, try to release ligament so that we get at least 2 to 3 centimeters of perceived penile length. The problem with this sensor ligament is like patients will not be able to get that elevation of the penis because of the loss of the ligament. Patient will be told that she has to use the penis to, whenever there's inflammation attempt, he has to hold the penis to support the penis. Otherwise, this does have a very good, response. There are two approach: suprapubic approach or probably from a subpubic approach. And techniques for we have this silicone, autologous fat, and collagen injections. Fillers, classifications, silicone, the way the silicone at rate which it escalated, it populated at the same rate, it dropped down, it fell into descent. Some research showed up to 80% complication rate. And yes verdict, 0. And autologous fat transfers, it gives an elevation of around 2 centimeters to 6 centimeters maximum girth, but it has its own complication of donor site complications, infections, perforation, probably, and of course, you have to repeat every 6 months. Ideal would be to go for a soft tissue hyaluronic acid, very popular, and it's probably selling like hotcakes. It's non-migratory, long-lasting action, affordable cost, biocompatibility. You can probably reach out from facet of 7.6 centimeters, you reach up to 11 centimeters. The maximum amount of hyaluronic acid can be used is up to 15 to 18 ml. And this how the whole principle is to inject it between the albuginea and the daughter's fascia. Of course, we will also be using for penile augmentations, which is being injected. And what we have seen surprising is that in patients, these patients do get a respite from early ejaculation also. And these are few cases. One thing we have around 5 cases of this is a personal experience where we have used hyaluronic acid fillers to enhance the girth of the penis post penile implant. Penile with no complications. Post penile implant, because of the extensive dissection after 6 months to 1 year, they do come with penile. Doctor, we feel that my penis is no more flaccid, though it's hard, no more flaccid. We did some 5 cases where we had a very successful rate of, see this is the case pre and post operative. For an implant we use Coloplast. And it's been more than 3-4 years they have been doing pretty well. And a few complications for hyaluronic acid. One thing is you should import post procedure. You make a point that you call the patient at your clinic regularly, because if you are individually use the hyaluronic acid and just keep it under the subdermal, there are reasons there can be possibilities of skin necrosis. In that case, you can use hyaluronic injection, simple to treat. But ensure that after injection, patient has to come to a clinic for a regular checkup. In one case, the technique was wrong, so we had a nodules. And how it is critical, as I told you, it's pretty good. Almost 11 centimeters from the baseline of 11 centimeters girth enhancement. This is albuginea grafting, where we harvest sufferness and probably put it into the launch nutrition, and the albuginea, it increases the girth in erect state, not recommended for patients with flaccid requesting. We have definitely graft procedures, autologous graft and allogenic graft. More is popular is like xenograft, porcine and bovine, which is very much available in the market. It's a simple thing, just make a subpubic incision and introduce, and it's probably biocompatible, non-antigenic, it works well with the good results. And this how, and this acellular probably, and we have this biodegradable scaffold, which also does the same principle as of autologous graft. And last is this one thing is reverenage. Probably we have this pneumatic, medically grade silicone implant kept under the skin, which probably gives anchored to the root of the penis with the polypropylene mesh. Pretty good, a very good response with both in flaccid and as well as in an erect state. It has both two kind of approaches, subpubic approaches and also the lateral scrotal approaches. Both are safe, effective, and I think this is the way forward. People are approaching a lot of studies with more than 50,000 cases. They have done with good response, and I think pneumatic is something that's well appreciated. So, fundamental paramount counseling, evaluation options available. That's for the doctor to choose and make out effective conducive patients is very important. Thank you.
Thank you, Dr. Shashidhar. So, how often you should inject the hyaluronic acid? So, you're saying about the injection.
Yeah. See, the whole point is like the FDA has approved cosmetic resins for other places, but ironically, when you use for penile injections, there's a lot of friction happening on. So the degradation rate is pretty high for penile injection. But you have seen comfortably 6 to 9 months, maximum up to 1 year. I think people are doing well.
Thank you.